Imagine believing someone is always out to get you, to cause you serious harm. You know it is not true, but a little voice inside your head says someone is planning to hurt you. You might decide to get them before they get you, or maybe you just keep your distance. Now imagine that someone is your mother or your father, or maybe a sibling or even your best friend. In the case of my great uncle, that someone was his mother. I chose this topic because I have both friends and family members who have been diagnosed with mental illnesses, the most common being schizophrenia. One day, my uncle had undergone a powerful auditory hallucination or heard voices that convinced him that his mother, my great-grandmother, was out to harm him. Taking the get them before they get you approach, my uncle stabbed his mother in her sleep, pinching her lungs, nearly killing her. By doing so, my uncle showed positive symptoms of schizophrenia, more specifically, paranoid schizophrenia. Positive symptoms of schizophrenia refer to feelings and behaviors that are not usually present. These symptoms include hallucinations, delusions, and disorganized thinking, speech, and behavior, such as pacing and rocking. Hallucinations may affect any of the five senses, visual and auditory being impacted most often. Such hallucinations include hearing voices or laughter that does not exist, or seeing images or faces of people whom are not present. Delusions take many forms, some of the most common being delusions of control, believing one's thoughts and behaviors are being controlled or manipulated, persecution, believing one will be harmed in the future or may be the center of a conspiracy, and grandiosity, an exaggerated sense of one's abilities. The inability to concentrate, responding to questions and statements with unrelated responses, and illogical behaviors explain the disorganized ways of those living with schizophrenia. Negative symptoms refer to the inability to show emotions, apathy, and lack of attention and pleasure in regularly performed activities. Due to the addition of abnormal psychological experience with positive symptoms, they have become easier to spot and treat than negative symptoms. Rather than adding, negative symptoms take away the ability to function normally. They tend to be more persistent than positive symptoms due to their treatment-resistant nature. This makes negative symptoms the main reason for hospitalization of patients living with schizophrenia. Before subtypes were removed, paranoid schizophrenia was the most common subtype of this chronic mental disorder. Those affected with the illness usually show signs between the ages of 16 and 30. The age of onset tends to be slightly earlier for males, who on average develop the illness at 18, while the average age of onset for females tends to be 25. While it is possible, it is highly unlikely for people to experience the onset of schizophrenia before the age of 10 or after the age of 45. While there is no direct cause of schizophrenia, it has been linked to both genetics and the structure of the brain. Though genetics is a factor, one is not guaranteed to develop the illness because a relative suffered or suffered from it. As far as structure, a controversial hypothesis known as the dopamine hypothesis states that the excessive amounts of the neurotransmitter dopamine is a reason for someone to suffer from schizophrenia. Along with this hypothesis, evidence has shown that a result of schizophrenia also stems from abnormal brain function, more specifically of the parietal and frontal lobes. The parietal lobe involves sensory input, and overactivation of them result in distortion of one's senses, such as voice recognition. These abnormalities are closely related to positive symptoms. The frontal lobe involves making plans and judgments. Underactivation of the frontal lobes result in impairments of organization, planning, and making judgments. These abnormalities are more closely related to negative symptoms. Dopamine is a neurotransmitter directly associated with schizophrenia. However, new findings suggest another neurotransmitter, glutamate, exhibits the same effects in its excess or lack thereof, and better explains the multitude of symptoms of the illness. Many people not only suffer from schizophrenia, but many other mental illnesses of the brain without knowing it, until their conditions have severely worsened. Some common signs that someone is suffering from schizophrenia include inappropriate laughing or crying, excessive walking, hostility, unacceptance and/or extreme reaction to criticism, insomnia, or oversleeping. Though these signs can be the result of numerous other problems, they are not to be taken lightly, and one may consider seeking medical help. Noticing signs that someone may be developing schizophrenia is important, and correct tests and treatments are necessary. To capture and analyze images of the brain, doctors may perform magnetic resonance imaging, MRI, or computed tomography scan, CAT scan. As pictured, CAT scans as well as MRIs show enlarged ventricles of the brain in schizophrenics. Along with this, schizophrenic brains show smaller amounts of tissue volume and activity. Contrary to popular belief, those living with schizophrenia have the ability to live fulfilling lives if proper steps are taken early. The number one tendency to be avoided is not accepting one's diagnosis. It is imperative that one comes to terms with their disorder, since it is the first and arguably the most crucial part of the healthy recovery. One should also seek both medical and therapeutic aid. While medication is helpful, it does not cure schizophrenia. It simply minimizes one's symptoms. Medications can sometimes leave the patient with harmful side effects, such as drowsiness, restlessness, and even seizures. This is why medication alone is not enough for treating the illness. Seeking therapy and support from other people with schizophrenia is another and very important way of treating and coping with it, or any chronic mental disorder for that matter. It is easy, especially during a psychotic episode, for one to feel utterly and completely alone. This is why it is important for schizophrenics to interact with others and not be afraid or ashamed to speak up about what they're going through. Discussing schizophrenia helps both the patient and the doctor better treat the illness. If one is not completely honest about their symptoms, medication doses, and side effects, if any, or state of mind as a whole, it will be much harder for others to help them, and their schizophrenia could potentially become worse. It is important to recognize and take immediate action when one suspects another is suffering from any mental disorder, not only schizophrenia. When my uncle first showed signs of schizophrenia, many disregarded it. Some thought he had a drinking problem, others thought it was something temporary. Unfortunately, my uncle also lived during a time when mental illness was not so openly accepted nor fully understood. Had my uncle received the proper attention and care for his disorder earlier on, it is likely that his schizophrenia would have been managed properly, and he would not have to live with the lifelong guilt of almost killing his mother. Schizophrenia and other mental illnesses are often difficult to detect. However, if a loved one is showing signs of mental illness, it is important for family members or friends to have an open and honest discussion with him or her about their concerns. Though one may not be able to force the individual to get professional care, they can offer encouragement and support. I hope my uncle's story is taken into consideration if and when you encounter someone who may be suffering from a mental illness. Please understand that schizophrenia is a mental disorder. Therefore, it is important to recognize its early signs, as this could potentially save their life.